Hi there, I'm Dr. Katie Benge from Trinity Court Surgery, and this is a short video just to talk about the kind of things that we talk through before having a coil fitted. So we try to send you out a text message in advance so that you can read through our consent form, which covers in writing a lot of the things that I'm just going to run through today. We always like to ask you that you are using an effective method of contraception for at least the 7 days prior to the coil fit, or that you've abstained from having sexual intercourse in that time. This is even the case if you are having one coil removed and another one fitted on the day. The reason for that is that sometimes we can remove your old coil, but for whatever reason we can't get another coil in, and that would leave you unprotected. So we do like to make sure that you are using some sort of contraception or having no sexual intercourse for 7 days before your appointment. It's always important to talk about contraception and saying that no method is 100% effective. There is a very small chance of failure with a coil, so it's approximately 1 in 100 chance of actually getting pregnant. But if you were to get pregnant with a coil in situ, there is a higher chance of it being an ectopic pregnancy than if you were to get pregnant, for example, using the contraceptive pill or a failed condom. Obviously, this kind of contraception doesn't protect you from sexually transmitted infections, only from pregnancy. And of course, there are other reasons for having, for example, a Mirena coil fitted, which can be for heavy menstrual bleeding or for HRT. We try to keep everything as a no-touch technique and as sterile as possible, because we are inserting a foreign body through the cervix into the uterus, and we don't want to introduce any infection, but there is always a small chance of risk of infection. What we tend to do on the day is examine you, doing what we call a bimanual examination, which is using our fingers inside to feel where the cervix is and to see whether your uterus is pointing upwards or backwards, because that will indicate which way we need to pull your cervix to straighten things out and make it easier to put the coil in. We do that first of all, and then what we'll do is we'll pop a speculum in to find your cervix and make that visible to us so we can then hold onto your cervix, which is called stabilising the cervix. At that point, it does get a little bit crampy, and we tend to talk you through the process as we're going so you know what to expect. Because we're going in blind, we're looking at the cervix, but we can't see your uterus where we're putting the coil into. We then have to measure this. We're all different, our anatomy is different, and so your uterus may be 5 centimetres in depth, or it may be up to 8 centimetres in depth, which is quite a significant difference. So we put something through the cervix and we measure the depth of your uterus, so that then when we go to insert the coil, which comes loaded into a small tube, which then goes into your uterus and then opens up inside, we know how far to put it in so that we get it in the right place. Even given that we are measuring your uterus, it is still possible that we can push the coil into the lining of the womb, or that it can move at a later date, and that's called a perforation. There's about a 2 in 1,000 risk of a perforation, and that can sometimes be noticed as increased pain lasting longer than a few weeks, or pain during sexual intercourse, or changes in your bleeding pattern. And if you feel those and you feel things are not settling, then it is important to see us afterwards. The other thing that can happen is your body just doesn't like it and pushes it out and contracts, pushes out the coil and rejects it, and that's called expulsion. And that tends to happen about 1 in 20, so that is a higher risk, although we don't often see people coming back with this. It is a small T-shaped device, which is usually about this size, so you probably should see it, but you may not always. If you're having the Mirena coil rather than a copper coil, it does hopefully make your periods a bit less frequent or a bit lighter, and may even stop them completely. However, a copper coil can do the opposite, and it can make your bleeding a bit heavier and a little bit more painful. There are a lot of nerves as well in the cervix, so as we are putting through a device to measure your uterus and then putting in the coil and holding on to the cervix, there's lots of opportunity for those nerves to be stimulated, and that can sometimes mean that your blood pressure drops and you feel a little bit lightheaded and dizzy. We try to keep the room cool, we try to talk to you throughout the procedure so that we know you're feeling okay, but if at any point you feel unwell, like you're dizzy, going to faint, please do let us know and we will stop the procedure. When you've had this fitted, assuming that it's all gone according to plan, if we've got your copper coil in or your Mirena coil in, just to reiterate that the copper coil is effective immediately, but a Mirena coil, it needs 7 days before it's effective. So you would need to either abstain from intercourse or use alternative methods of contraception for 7 days after it's fitted. I think that's the majority of things. I'm sure you will have some questions when you come in for your fitting, and we will talk you through the procedure as we go, but that's just to reiterate some of the things that happen and the way we go about the procedure. So we would get you undressed onto the couch, having your feet at the end of the couch and shuffling your bottom towards the end. We will do that bimanual examination where we feel for your cervix and put a little bit of local anaesthetic around the cervix at the same time. Then we will have a look with a speculum, hopefully find your cervix in a nice position where you're comfortable. Then we will hold onto the cervix, which is when you get a bit of cramping. We will put a measuring device through the cervix to feel how far your uterus goes. And then we will put the coil in through a device that it's loaded into, open it up in the right place, then remove that device and cut the strings for you. Okay, I hope that answers some questions and you're well prepared for coming in for your appointment.